Now, I know you've seen a lot of women with these symptoms. And then you've always wondered what could be the cause of these symptoms. Well, today we are going to dive right into it. We are going to talk about that one condition that causes these symptoms and is also a leading cause of infertility in women. Stay tuned. Hello family, you're welcome back to Midwife Key. Now, about this condition, a lot of my audience have asked me to talk about it, and today is finally that day. We are going to talk about PCOS, which is Polycystic Ovary Syndrome. Now, when we say Polycystic Ovary Syndrome, it just means multiple cysts on your ovaries. Polycystic, multiple cysts on your ovaries. Now, PCOS is a hormonal disorder that happens in females, in which their ovaries produce unusually high levels of hormones called androgens, which are male hormones, causing their reproductive hormones to become imbalanced. Now, let me take you through how this happens. See, your ovaries produce estrogen, which contributes to follicle development for ovulation to happen. But for estrogen to be produced, a hormone called androgen, which is actually a male hormone, is produced first. Then it is converted by an enzyme called aromatase into estrogen for that entire process to happen. So in the case of PCOS, that male hormone called androgens, which are produced first, are over or excessively produced. And because of this excess production, there's unusually high levels of androgen, which leads to arrested follicle development, affecting ovulation, and causing irregular menstrual cycles, leading to infertility. Now, because follicle development is affected, your ovaries may actually fail in releasing eggs, which may cause cysts to form, which are small fluid-like sacs that may contain the eggs that are supposed to be released. But in this case, these eggs may not be released, but they may be contained in these cysts and they will be sitting on your ovaries. Now, despite the name polycystic, you don't need to have the cyst on your ovaries to be diagnosed with PCOS. And these cysts are not dangerous, nor painful. Because of high levels of androgen, women with PCOS often have excess hair growth on their face, chest or abdomen, acne or oily skin, darkened skin patches, especially on their necks or underarms. They usually have weight gain issues or difficulty in losing weight. They have thinning hairs on their scalp, and they have irregular menstrual cycles, which is irregular or missed periods due to irregular ovulation, which causes infertility or difficulty in getting pregnant. Now, some other factors that may contribute to the development of PCOS are insulin resistance. Insulin is a hormone produced by the pancreas that helps your body process or break down sugar or glucose and uses it for energy. Insulin resistance means your body doesn't process insulin correctly, leading to high glucose levels in your blood. The pancreas then produces more insulin to compensate, leading to elevated insulin levels in your blood. High insulin levels then stimulate the ovaries to make or produce more androgens. And of course, these excess level of androgens interfere with normal ovulation and cause hormonal issues that are seen in PCOS. Obesity can also contribute to development of PCOS because excess fat tissue, especially visceral fat, contributes to insulin resistance, which means the body struggles to use insulin effectively. And in this case, the pancreas then produces more insulin to compensate, leading to elevated levels of insulin in your blood. And then, of course, these high insulin levels stimulate your ovaries to make more androgens, which leads to PCOS. Now, obesity acts as a major environmental trigger, worsening insulin resistance and hormonal imbalances, thereby intensifying PCOS symptoms. Now, due to obesity, people with PCOS can tend to have chronic low-grade inflammation due to increased inflammatory substances like adipokines, which worsens insulin resistance. There is no cure for PCOS, but treatment options are available for the symptoms. And number one is lifestyle management, like eating balanced nutrition, often lower glycemic whole foods, doing regular physical activity. Weight management can improve insulin sensitivity and improve ovulation. Now note that PCOS affects people of all body sizes, and lifestyle changes are helpful even without weight loss. Medications can be given to regulate periods and hormones, like hormonal birth control pills, which can be given to regulate menstrual cycles, lower androgen levels, help with acne and excess hair growth, and it can also protect the uterine lining. Treatment can be given for insulin resistance, which improves insulin sensitivity, helps regulate your periods, and may reduce androgen levels and support ovulation as well. Treatment can be given for acne and excessive hair growth. Anti-androgen medications, topical acne treatments, hair removal methods like laser, and then prescription creams can be given for facial hair. Fertility treatments can also be given if pregnancy is the goal, like ovulation induction medications. Assisted reproductive technologies like in vitro fertilization, which is IVF, or intrauterine insemination, IUIs, can be done to aid fertility. Many people with PCOS can get pregnant though, sometimes with minimal treatment. Now, if you're experiencing any of the symptoms that I've described with PCOS, please, it's very important to go see your health provider so that blood tests on androgen levels can be conducted, and ultrasounds on polycystic appearing ovaries can also be done to rule out or to confirm polycystic ovarian syndrome. Now, unfortunately, having PCOS can lead to long-term health risks like type 2 diabetes, high blood pressure, uterine cancer, and some heart problems. It's been wonderful having you on this episode again on Midwife Key. Thank you so much for making a date with me. Please, it is very important to me that you like, comment, share this video, and you subscribe to my channel, because it is what drives me to make my videos. In fact, it is what drives me to do my research so that I can come here and educate you. Until next time, it's bye-bye.